Hi everyone, it's me, Gwendolyn Koken, and I'm here to talk about my 6-month post-inguinal surgery that I had in January. Um, yeah, so when I was looking for information on YouTube about female inguinal surgeries, I didn't really see much of anything on there, so I thought that I should put something up there about it because I enjoy YouTube. Okay, so, yeah, it was cold and it was ugly when I had my surgery, and now it's beautiful and the sun is shining and I have a new body, I guess. uh, it's been painful. It's been restrictive. It's been life altering. Pretty much because I have to change everything that I do. I have to be really careful. And I'm sure you notice that I like to work really hard. I like to get in there and get stuff done. But when you have a surgery in the lower part of your body, which is connected to every movement you do, that's not so easy to get everything done. And you have to rely on people to help you. So I think that's been the biggest challenge, is just kind of letting myself be helped by everybody else. So don't forget that when you have your surgery. People really need to help you, and that's okay. Yes, people need to help you. You will have pain. You will feel it. You will recognize your limitations. You will recognize that things are different. Every move you make, you tend to feel it. It's not that you feel the hernia per se anymore, because they put this patch, for mine, it was not laparoscopic. They cut through the skin, along the bikini line, and they put in this like 3-inch by 2-inch mesh over the muscles that were torn. Apparently it was hereditary for me. It was going to happen no matter what, because my parents, my grandparents, my sister children, we all had hernias. Myself, but it's just a matter of time, I guess, for it to happen. And it happened when I was 51. Yeah, now I'm 52. So anyway, just do the surgery, get it done, take care of yourself, let it heal, and you'll be back to a different you, but you still can do just about everything and anything you want to do. You just have to do it in stages, and again, rely on people's help. So, standing here, I can feel it. It used to not allow me, the recovery part used to not allow me to do things. Now I do them and then think afterwards, oh, I should have done that a little slower, or maybe I should ask for help. I mean, there was like 3 months into it when I was moving bark chips. I felt the hernia want to come out at one point and kind of like went back in. And I'm like, oh my gosh. But that's going to happen if your tissue is ripped, and they didn't sew it back together. They just sewed the hernia mesh onto the muscles. And no, the pain those first 2 weeks was just incredible. But I knew it would go. I knew it would go away. And, I think I took the codone, the hydrocodone, the stuff that everybody's having a problem with, twice. And I had a horrendous headache. So I didn't like it. So I didn't take that. So my deal was ibuprofen and ice. Ice was extremely helpful. And now I like to use ice all the time. Yeah, I'm a massage therapist. I tell people to use ice all the time. But now I really in need. I get it. Use ice. Yeah. So I did have to be careful also, because there's a chance I could get a hernia on the other side. So when you get a hernia, your body's just susceptible to that kind of stuff. And not everybody is, but some people are. But I do think, my takeaway from all of this is do the surgery. You don't want to feel like your guts are always falling out of your body, that you're going to pinch something, that you're going to end up dying because you're going to end up getting sick from your own body. And it's a blow to the ego, when your tissue's ripped. It's not the same as all these other surgeries. I can't even relate to the pain that people will go through with cancer. I know a lot of people in my life have had cancer, and it's just horrendous. It's that's a whole nother world of emotional volatility within your soul. When you have a hernia, that's like a violation against your strength and your endurance. And whoa. Yeah, that's been a hard one because I've always considered myself to be really strong and capable of just about everything, kind of. And it's not the case. We are all vulnerable. So, again, take away message, do the surgery, take the time to repair, take care of yourself, let people help you, and it'll be okay. The mesh has come a long way. There's always a chance for it to be rejected, but I don't think so. For me, so far it hasn't, and I'm not going to focus on that. I don't think it will be, but they do go very well, and there's a little numbness, but not what I was afraid would happen, because my doctor said if there's a nerve in the way, we just cut it. And I'm like, ah! But no, it's okay. She was a great doctor. Her assistant was great. Everybody was great at the hospital. And again, 6 months later, I have a different look on life. I try to let people be more involved in my life for helping or just whatever. And I want to thank all those people for that. My husband, my son, my daughter, and my clients actually have been wanting to help too, bring my stuff in and out of their house, which is totally great. But anyway, 6 months later, still taking it a little easier, still taking some time to repair, but just do it. Thank you for watching. Bye.